And
Is it in my UCSD email? Maybe.
it is.
Okay.
Okay, you can unmute yourself and then we're ready to go.
I'm live again. There it is.
Okay.
Okay. So let me try that there. Ooh. Oh, cool. Let's see here. Maybe I didn't get anything from you. Let me make sure it didn't go somewhere unusual here. That's okay, Susan. I think I'll just have you read off the questions then. That might be easiest.
Actually, Lee, do you want to unmute and kind of present that issue? Because I think it's very interesting.
Oh, hi, Dr. Pedersen. I had my second Moderna vaccine 2 weeks ago, a little over 2 weeks ago. And my husband found out that there's a quantitative, a SARS-CoV to semi-quantitative test. So we both had that done. And his was rather high. It was 164. Mine just got back yesterday, my results, and it was less than 0.40, undetectable.
Gotcha.
I wonder, what do I do with that information now?
Yeah, that's actually a very, very key question. So can I ask you a question?
Sure.
Regarding what medications you're on?
I'm on CellCept, and I was told to continue taking that. Fair
enough. Okay. So I wouldn't, we have fairly limited information with regards to how CellCept affects other vaccinations. We do know that typically when people are on CellCept and they get protein-based vaccines, so these would be things like the influenza vaccine or a carbohydrate or sugar-based vaccine, that'd be something like the pneumonia vaccine. It typically doesn't affect the response or antibody titer that you're alluding to. So number one, in general, most of us are saying continue on medications like CellCept around the time of the vaccinations. The other thing that is really important to appreciate is that we really don't know which antibody tests to trust at this point in time. So because of that, it's a little hard to say what the clinical significance of having a less than robust antibody response is. However, since you are, tested more than a couple weeks out from your second shot, and the response was low, one option is to use a different antibody test. That's probably where I would go from here. Additionally, I think I would continue with the precautions, the standard precautions that you were taking prior to being vaccinated.
Well, that's a little tough.
Yeah.
Let's wait forever. And I was very cautious, but I did go to the supermarket, but I had an N95 mask. But, I have to socialize a little bit. Like, we're going over to somebody's house for dinner on Sunday. They're vaccinated. So we had agreed to do that. And I just can't continue not socializing at all, other than, on the patio, which is socializing we've been doing basically.
Yeah, no, it's the other, because I think as time goes on, there are going to be more people in your situation. And what I'm guessing is going to happen is that people like yourself will probably be offered another vaccine. Maybe so you received one of the RNA-based vaccines. You may be offered like an adenovirus-based vaccine, like the Johnson & Johnson vaccine. or the Novavax vaccine, which is a more standard kind of traditional technology based on protein.
Mhm.
Yeah.
Yeah, I know they're doing some studies at Washington University in particular, and St. Louis. And my husband's been in touch with one of the doctors there. And he said something about T cells playing a part also in our immune response.
Absolutely. The issue is that we don't necessarily have a good way to monitor the T cell response to the vaccine.
Mm.
So the antibodies are a pretty simple, straightforward readout. And those antibody tests have been using to kind of determine if somebody's serum after they've had an infection would be good to use for that convalescent serum that would be used to treat very ill people.
Mm-hmm.
How
about that mononuclear, what is it called? What Trump had, mononuclear antibodies?
Yeah, the Regeneron. Yeah.
Is that effective? And I've heard that it's best to do it really early, within like 72 hours of symptoms, if possible, or up to 10 days.
Yep. So it looks like those kinds of treatments can be very good if given early on, like you're alluding to. Also, it looks like they can be used prophylactically. What that means is that if you were to give these antibodies to a large group of people, and then they were to have an exposure, that group of people that already had these antibodies circulating in them would be less likely to get an infection, because they provide protection, much like in the way that we anticipate that the antibodies that somebody makes after a vaccine provides them with protection.
Mm-hmm. Okay.
Okay, I have, related to that, I have a question that just came in. Okay, where is it? Based on this conversation, should all of us who have been vaccinated get an antibody test?
Yeah. So I don't know. So some of my patients probably know what my opinion is on that already.
Ooh.
And for the vast majority of my patients, I am offering to do that.
Wow.
Yeah. Just because I don't want people to feel bulletproof. I use that I use that term a lot. I don't want people to feel bulletproof when when you're not bulletproof, if you will. And kind of the thought behind that is that a lot of people are on medicines, or some people are on medicines that can absolutely affect an antibody response or affect the response of a vaccine. In which case, the only way to know if that's the case is to actually check. A more common clinical situation where we routinely check for antibody response to a vaccine is for the hepatitis B vaccine. So essentially, all healthcare workers in the U.S. Are by and large required to show immunity to the hepatitis B vaccine, or at least have taken the vaccine. And that's one of these vaccines, much like the Pfizer and the Moderna vaccines, where you get one shot and then you get a booster. You get boosters later, if you will. And we go back and check for antibodies to what you were immunized with. And if healthcare workers get their priming dose, their booster shots, and don't make antibodies, they typically go back and get additional booster shots. And we know from that kind of experience that some people, regardless of how many times you boost them, they just don't make an antibody response that's significant.
So those with scleroderma, it's less likely they'll have an antibody response.
Hard to say. I wouldn't say that the scleroderma alone would be the root cause. I'd say the main issue would be people with scleroderma on medicines, and the medicines would be the main reason why people would lack a robust response. So I think that's kind of so here's where I'll be a little more opinion-based more than anything else. So because I've offered to test my patients for their response, I've gone through and tried to look at the different antibody tests that are commercially available, if you will. For what it's worth, I like the LabCorp test. That's a semi-quantitative antibody test. The reason I like that one is because that specific test is for antibodies against the spike protein of the virus. The spike protein is when you see that cartoon and there's the little red thing sticking out from the circle. That's the spike protein. That is what the RNA in the Moderna and the Pfizer vaccines code for, is that spike protein. So that's what you're intended to make antibodies against. And it also checks semi-quantitatively for antibodies against the receptor binding domain. I know it gets a little technical here, but you have like a big protein, and it's thought that if you have antibodies to a particular area, those are very good at neutralizing the virus. So when they're going and looking for the convalescent plasma, they wanted antibodies against a certain area, because it was thought that antibodies against that certain area would prevent infections or prevent very significant infections. So I'm kind of checking to see if the antibodies that people make after a vaccine are against that same region.
And how have been the result? I mean, what's the results of the
so far, I've only done it in 3 patients, and all 3 had, so the responses were variable or different in all 3. One person actually with scleroderma, who's not here today, her response was off the charts. Her response was greater than the upper limit of detection. She is not on any immunotherapy. I've had another patient who's on a medicine called Rituxan. I don't know if people in the group are familiar with Rituxan, but it's kind of like a B cell eraser. So it erases your antibody producing cells. We purposely held her next dose of medicine so that she could get her vaccine while the medicine was out, so that she'd hopefully have a response. She had a significant response as per the output there. And then another person on medicine who we didn't hold it had a response on Humira and methotrexate. So a pretty common combination for people with like an inflammatory arthritis. Yeah. Oh, sorry, Susan, I couldn't hear you.
Carl, can you unmute and ask that question, because it might be easier for you to explain.
Okay, well, I sent both you and Dr. Pedersen a list of my questions.
My ears are open.
All right, the first one, most of these, of course, are based on us already being immunized. Can we carpool with somebody who's immunized?
Yes.
That's a close indoor. I know the CDC says, yeah, you can be indoors with these people, but this is really indoors and close.
Absolutely. I think it's reasonable if both people have been vaccinated and they're 2 weeks out from their second shot or 2 weeks out from their Johnson & Johnson shot, being in the car with that person is reasonable.
Okay. Second question, how about going to a grocery store?
So that's what I'm hoping, is that people that have been vaccinated now feel more comfortable going to the pharmacy, going to the grocery store.
Yes. Okay. How about going to a hair salon? Not that I need a haircut.
So the hair salon is a tricky one. It kind of depends on probably on how they're running their show at this point in time a little bit. A lot of places should still be, because in San Diego, as most of us all know, we're still in the purple tier, if you will. When we get to the red tier, which we probably will, I'm imagining it around April, if not before. The what you really want to have happen at the hair salon is for there to be a limited number of people and people wearing masks. If you yourself are masked up, you shouldn't be it should be safe.
Okay. Next one, and this one's not covered by CDC that I've seen. Air travel.
Air travel, yeah. Most people know I've been very strict and saying don't get on the airplane, if you will. And there's a couple of reasons why I don't promote travel or air travel at this point in time. Is number one, so I think getting a COVID test within 72 hours of taking off is a bit of a joke, if you will, for the general public, because people like ourselves who live in San Diego could get a test, go to Vegas for like a full day and do whatever you chose to do, and then get back on the plane without having to be retested. So that 72-hour window just isn't really stringent enough to not have people in that closed area that have been properly screened, if you will. And then kind of the issue there is really just the sheer number of people, if you will. Sheer number of people. And then with travel, you start moving the variants around. And that's what all of us don't want to have happen at this point in time, because it may not be the current variants that are an issue, but the variants of the variants may become an issue.
Right. My next question, based on that answer, I'm assuming it will be the same answer. If, a tour bus, if you're, I would assume we should avoid that.
Avoid the tour bus for now. Yeah. What I think is going to happen with travel in the near future is that things will open up and be restricted to people that have a vaccine card that shows that they've had their vaccine, in which case everybody on the tour bus will have been vaccinated. And then with time, there'll be more information about how safe that is. But I imagine that's going to be like the first step towards doing things with people from households other than your own.
Right. Yeah, I think the same thing. The next one is once we get into the red zone and they open up indoor dining with 25% capacity, yes or no?
So I'll chicken out of that one a little bit, and I'll say we're lucky to live in San Diego.
Okay.
So choose the patio.
Okay, that was my next question. So outdoor dining, you think is okay?
Just because it's been very difficult for the researchers who study outdoor transmission to find clusters of outdoor transmission. Those people have to work very hard to show how outdoor groups spread the virus.
Right.
And so for the time being, be outdoors if you can. I know a lot of people in this group here are very sensitive to the cold, if you will, but fortunately we live in San Diego, and so I would say try to do it outdoors as much as possible for the time being.
Okay, next one, when they open up, movie theaters.
Movie theaters is a bit like the tour bus question, because you're in you're enclosed with a bunch of people that you don't know. Movie theaters I don't know how the movie theaters are going to handle it, because last time we were in the red, you didn't have to have like a vaccine card, if you will. But I kind of think it's very reasonable for companies and businesses to say, like, during these hours, we're only going to have people come in that have a vaccine card, because that will be inviting to people who have been vaccinated who may not go out otherwise.
Right. So
the movie, I would personally hold off, because it's like the tour bus.
Okay.
Yeah.
Next one would be I'm already anticipating your answer, going to the gym.
Yep. The gyms have done a really good job of putting the equipment out in the parking lots. And I think the gyms, even when we go to the red tier, are only able to operate at like 10% capacity, if you will, in the red tier. I kind of think that the gyms, I was making that point earlier, where some businesses will open up to people that have been vaccinated. I think the gyms are a place where it really makes sense, where during like certain hours of the day, they will allow people in that have had both vaccines.
Okay. So
I kind of see that happening. They're essentially going to let, just like how the grocery stores would have a senior hour, the gyms are going to have senior hours for people that have been vaccinated, if I had to guess. I just think it's a good business decision.
Okay. How about getting a massage? Just
Massage is essentially the same risk as the haircut.
yeah. How about if it's in your own home? Somebody that comes to your house to give you a massage. So
I'd
it's
say
only
it's
one person.
Yeah. I'd still put in the same risk as getting a haircut. Everyone should be okay as long as you're vaccinated. As long as you're vaccinated and people are masked up. Because that's part of the CDC kind of guidelines. Now there's the grandparent rule, if you will, is if one household has people that have been fully vaccinated, people from another household can come and visit as long as they're at low risk.
Okay.
Yeah.
And how about a repairman who's unvaccinated coming to your house to fix things? Whether they're relative or not, it would seem that would be okay also then.
That would be okay too, as long as that person is at low risk. I think you may consider them to be a high risk because they're in multiple households, if you will.
What about going to a hotel?
Yeah, good question.
Yeah, hotels should be safe. I know a lot of hotels, the hotel architecture is a little different nowadays. Not every place has like some big lobby where people congregate. A lot of places there's, some lobby through which they're going to control traffic, and then you walk out to get to your room.
What about bringing back our cleaning ladies?
Yeah, should be okay. Yeah, should be okay. Yeah, I like that question a lot.
Those were all my questions. So.
Okay, Lee, you had a couple questions. Do you want to unmute and ask them? Oh, sorry.
Sorry, Lee.
I'm sorry. I'm sorry. Okay, I have a couple questions. Has it been determined if vaccinated people cannot transmit the virus or just less likely?
Yeah. So the jury's still out on that, but it looks like it's about 20-fold less likely, more or less. And that's based on the recent information from out of Israel. So maybe some people in the group here are aware that Israel paid a premium for the Pfizer vaccine. So they paid more per dose than other countries, in which case Pfizer gladly gave them a lot of doses. Additionally, they have a nationalized healthcare system, and the geography is not so spread out where it makes it difficult to kind of coordinate things. And so I don't know what the numbers are at, but it looks like they're obviously percentage-wise with regards to their population ahead of everybody else. And Israel's probably going to be the first place to reach herd immunity if that's going to happen.
Yeah.
And so we're going to kind of learn from them and apply what happens there everywhere else. With the Moderna vaccine, what Moderna did is that in the clinical trials, before people got the second dose, they swabbed them for virus. And so some of those people after the first dose, the people who didn't get placebo, had lower titers of the virus. So they had been infected after the first dose, but their titers were lower compared to the people who got the placebo. And so, and it's thought once again that as long as if you're shedding less virus, you're less likely to transmit it. And so presumably the more protection you have, the more protection you provide for people around you.
I have another question for you. So I'm still unmuted, right?
I can hear you.
Oh, okay. So can you give us an answer that's not politically correct, based on your opinion of which of the vaccines are best?
Absolutely.
I know the politically correct answer is just take the first one that you can get. They're all
Yeah.
great. But what's your true opinion?
Yeah. So I think I like that question, because I think what someone in my shoes prioritizes might be different than what somebody else prioritizes. So someone like me, I like the fact that it doesn't matter which one you get, you're not likely to end up in hospital or die.
Okay.
Because most people will say, like, I'll be sick for a few days. Who cares? It's much better than having to like go to the hospital and end up in the ICU. In which case, from that perspective, it doesn't matter. When it does become important is for kind of questions that we don't know the answers to yet, I would say. And it's going back to what Susan asked me is, which vaccine is going to make it less likely for you to give it to other people if you yourself are to be an asymptomatic spreader. And so ideally, I would say get the one that in time is associated with less asymptomatic spread.
And you don't know which one of the vaccines.
Yeah, which one is that?
Yeah, you don't know, and it really you just don't know. Presumably, it's going to be the RNA-based ones, based on the efficacy with regards to symptomatic infections. Just because the Pfizer and the Moderna are somewhere in the range of 90%, and the Johnson & Johnson somewhere in the range of 70%.
So from a scleroderma patient, if I had a choice between all three vaccines, you would suggest?
Get the Pfizer or the Moderna.
Okay.
Yeah, get the Pfizer or the Moderna.
Okay.
Yeah. Because the other thing that happens is that you're going to be more informed sooner with the Pfizer and the Moderna, just because the rollout for those was within kind of the same month of one another. You already have, tens of millions of people, hundreds of millions of people behind you, from whose experience you're going to be able to draw upon. So you're just going to know more about what that vaccine is going to do for you sooner in comparison to the Johnson & Johnson.
Okay. Someone had a question about you're taking your dog to the groomer, and if the groomer doesn't wear a mask, and is it possible there's a danger there?
I like that question a lot, because so it one of like the like a silly question is let's say kind of what Carl was asking was like, can two people who are or it's like for the grandparent role, let's say the grandparents go visit the grandkids, and there's like one household has a dog or whatever. Can the dog still transmit it because the dog's part of a household that hasn't been, or the dog's not vaccinated and part of that household? So far as I know, there haven't been any known transmissions from dogs or cats to their owners. Yeah.
Okay. Let's see.
So the questions I asked and you were answering, was that based on our susceptibility to getting testing positive from the other people in the hair salon, for example, or was it based on the risk of us transmitting to them?
It's based on them giving to you.
Okay. And so when Pfizer and Moderna say 95% protected, what exactly does that mean?
Yeah, so even if you get the vaccine, there's still a chance that you'll have a symptomatic infection. So, but 95% of the time, if you're exposed, you're not likely to have a symptomatic infection.
Does it also mean that if you're in that 5% that gets a symptom, you're still less likely to get hospitalized and die?
That's right. In all the studies, all three, essentially people don't get hospitalized and they don't die.
So that's basically 100% protected from serious illness and death, is what you're saying.
And that's where the public information comes out, or like the public health people say, just get whatever. And because if you don't get hospitalized and you don't die, the hospital system's not likely to crash, and you're going to be okay. The healthcare system's not going to crash, and you're going to be okay.
And those of us with scleroderma, are those figures for just getting sick the same 95% as it is for the general public? I think we heard from some professional previously that the numbers are more like 10% less than that for scleroderma.
Yeah, it's really hard because the statistics aren't there. The kind of the surprising thing is that based on the kind of the most recent information that we have for just people with autoimmune diseases in general, they don't seem more likely to catch the virus, and don't seem more likely to die. Let's say if you haven't had the vaccine in comparison to the general public, which is a little surprising considering the medications that we have and kind of underlying organ function.
Yeah. Okay. That's
Yeah.
good.
Okay, I have some questions from the audience. What happens if someone received a tetanus shot 1 week after the first Pfizer shot and 14 days before the second Pfizer shot? Does the COVID vaccine have to be started over again?
Yeah. So I don't know who is asking that question, but my question for you, because and hopefully people can help me out with this, is that there should be like a fairly good list of screening questions that you are asked before they put the needle in your arm. Was that person asked before
Bonnie,
they got?
That was me, doctor. It was my son. They didn't ask the screening question, and he wasn't aware that there could be potential problems. So it happened.
Gotcha. Okay. So that I think is a real problem nationwide, is that we're not asking the screening questions, or people just answer no, 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 or yes, 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 because you got your golden ticket and you're ready to get in line. But there are some things that delay when you probably should get the vaccine. Number one, having another vaccine within 2 weeks. That's pretty general recommendation. Some places say 30 days, just kind of depends a little bit. That rule depends a little bit on the states, if you will, or the states have kind of made their own rules. Pretty much nationwide, everyone's trying to abide by, if you've had a COVID-19 infection, to wait 90 days before you get the vaccine. I personally have had patients who've had COVID within 90 days and been vaccinated.
Okay, I think what I did was his second Pfizer shot would be within 10 days of his tetanus shot. So should he push out the second Pfizer shot?
I would say stick to the schedule.
Stick to the schedule. Okay.
Stick to the
great.
schedule. Yeah.
Right.
The issue is what they're worried about is people having adverse reactions and then not knowing what to attribute it to.
Okay, great. Thank you so much.
That's kind of the key thing there. Yeah. But I do want to encourage everyone to tell their loved ones, if they've had a COVID infection, to truly wait the 90 days before you get vaccinated.
Okay.
I know, because it's just so difficult. It's difficult to wait if someone's offering you a vaccine, because everyone wants that level of protection. But if you've had COVID, it's very unlikely within 4 months to be reinfected.
Okay.
And so that's kind of where that 90-day wait period comes from.
All right. Thank you so much.
I think I heard from Dr. Fauci that if you've been infected with COVID, you only need one of the vaccinations.
Yeah. Oh, I like this. This is good. So in Mount Sinai, Carl does a lot of reading here. So Mount Sinai, as well as University of Maryland, there are some limited studies where people had COVID, and then you gave them one shot of the vaccines, and then they checked antibody responses. And those people who had COVID then got one dose of, I believe it's Pfizer, then had higher antibody responses than in comparison to people that only had like one injection of the Pfizer. And the antibody response looked comparable to people who've had 2 shots. Yeah. Yeah. So the jury's still out on that one a little bit. There was some talk of just giving 1 shot to the people who have had COVID, because you save a lot in doses. It sounds crazy, but you do save a lot of doses, and logistically it's easier. Yeah.
So I've heard that transmission from children to adults is not as efficient as adult to adult. Is that true?
It seems like kids shed less for what it's worth. Yeah. It truly seems like the viral load in kids is less, and that's why we haven't probably had the issues at the schools. Yeah. Yeah, I'll just add a little something. My big concern with the schools is when you open up, the parents become more active.
Oh.
That's yeah. As much as it is for the safety of the kids, but as soon as you kind of open up the schools, just society starts moving more, and you just want as many people to be vaccinated more before everybody starts moving more. Yeah.
Okay, let's open it up to the gallery. Other questions or other comments? Go ahead, Lee.
Okay, yes. Given my low status of antibodies, supposedly after the second Moderna, I wonder how safe it is to get together with my son, his wife. They have a baby turned 1 just the other day, and possibly the mother-in-law out eating out on a patio in a restaurant. I'm concerned that I may give it to them, or they may give it to me. I think I'd feel worse if for some reason I had it and I gave it to them. How safe is it?
I think so you have that extra little bit of information, and I think for all given purposes, you have to assume you're not vaccinated.
Really?
And so you have to kind of behave the same way you did as before. One thing that may kind of change your thinking there is different antibody tests. Because I don't know if people remember, but like back in March and April, people were trying to get antibody testing to see if they'd already had it.
Mm-hmm.
At that point in time, the antibody tests were very unreliable. And that's why you couldn't reliably figure out if people had the infection and cleared it, or what the asymptomatic carrier rate was. But the antibody tests have improved with time, like a lot of things have improved with time. But I still think in your situation, it might be worth just getting a different antibody test done.
Well, I had that one that you mentioned, the semi-quantitative by LabCorp.
Yeah.
Should I redo that one or get a different one entirely?
Go to Quest. Get the Quest test. So Quest is another one of these.
Just a regular antibody test.
Make sure it's IgG.
IgG?
IgG, SARS-CoV-2.
IgG, SARS-CoV. Okay.
And then against the spike protein, because that's what you were immunized with. So you really almost have to look at the test that was ordered by the lab. The thing that I'm a little reassured by in your situation is that your husband was tested at the same time, and he had a response. So it seems like it.
A week earlier, yeah.
Yeah, the lab ordered the desired test, if you will. Yeah.
I guess so. It says it's that test.
Yeah, there'll always be like a test ID that you can easily Google at the company's website to make sure.
Oh, okay. Okay. It makes life difficult now.
Agreed. Yeah.
So
Agreed. For someone like yourself, that's the whole purpose of herd immunity. Because we recognize that the vaccines aren't going to work for everybody, and we need to still protect them. And so that's why everyone needs to get the shot, so you can protect the people who got the shot and it just didn't work.
Yeah.
So you think everyone with scleroderma should have an antibody test to see if it worked.
I am recommending it to my patients because what I think the medical community already checks to see if you responded to your hepatitis B vaccine. Why would you not do it for this? People don't care about, people are fairly low risk for hepatitis B because most people aren't getting blood transfusions and doing IV drugs. Most of us like to go out and just do anything, in which case it just makes sense to me for people to know where they stand.
I have another question.
Dr. Pedersen, when I got my first test, I had a sore arm afterwards, so I was happy about that because it told me it was effective. But after my second shot, I had no reaction whatsoever. Is that common, or do I have possibly the same issue that Lee had? I've heard that older people have less reaction than younger people to the shots. Is that accurate?
That is accurate. That's what happened. I know the data a little better from Moderna. The younger people were a little less likely, or excuse me, the younger people are more likely to have an adverse reaction with the second shot compared to the older grouping. But at the same time, it doesn't look like you can really read into how sore or how bad of a reaction you had to the vaccine was to figure out if it worked.
And my husband, he had a good numbers, and he didn't have any reaction other than a sore arm.
Yeah.
But I guess you can't read into it.
Can't read it.
I
Yeah.
have another question. How safe is it going to the dentist? I have an appointment Monday morning for just a routine cleaning. I asked that they wear N95 mask or double mask. And I have the first appointment of the day. How safe is it?
So this is a unique situation because I obviously have some patients that are dentists, and I've been asking them: how did you get your vaccine? How about the people in your staff? Did they get vaccinated, if you will? So essentially, everyone like in a dentist's office at this point in time should be status post one shot if they wanted it. There's no reason for anybody working in a dental office, doesn't matter what your job is at the dental office, should have had at least one shot at this point in time. In which case, while you're at risk of them being those asymptomatic carriers, they should be less likely to be asymptomatic carriers at this point in time. And you're probably okay because you're not hanging out in the waiting room with other people because you're going to be showing up before everybody else. Yeah.
Right. And I have to stay in the car until they call me.
Yeah. But so they're providing a bubble for you. That's what I would say. Your dental office is
that, and they have air cleaners and all sorts of things they claim. I went once before, and I went with great trepidation. I survived that. So hopefully I survived this.
Yeah.
Okay,
Yeah.
so what is your feeling about the new virus strains?
Yeah. I think it's the new virus strains that are going to cause symptomatic infections in people who have been vaccinated. But I don't expect the infections to be severe. I mean, it's going to be unlikely for people to have to end up in hospital because of the infection. That's kind of what's been playing out a little bit as well. So the one thing about the Johnson & Johnson clinical trial, a lot of patients in the Johnson & Johnson clinical trial were from South Africa, where everyone has kind of heard like the South African variant. And so it's known to be efficacious against the South African variant. A little less so compared to the main variant that circles in the US at this point in time. But it's efficacious. And even the people in the clinical trial who got the vaccine still got sick. They didn't end up in hospital. Yeah, so the current like the current variants, like the UK variant or the California variant or the Brazilian variant, you pick your variant. It seems that the vaccines are providing protection. Okay. So that's why I say it's the variants of the variants that you have to worry about. That I don't want to be nationalistic, but are probably going to pop up outside of the US just because we look like we're doing relatively better than other places with getting people vaccinated. And so as long as they're spread, there's going to be more variants with time, and it will be reintroduced to other places with time.
Do we know how long this vaccine will protect us?
6 months. That's what that's about what the data says. Yeah.
You mean we have to get revaccinated in 6 months?
We anticipate it being a longer period of time, but there's really only good data for 6 months.
Oh my gosh.
Yeah. That's why we're still very much relying on the nice volunteers in the clinical trials, because those are the people who are going to provide us with the information that we need to move us all forward.
Oh my gosh.
Yeah. So like the hard firm number is 6 months. We anticipate it being longer, but that is a good point, because I've like made the mental note to myself is here's the dates on my vaccine card. I need to just be aware of what's happening 6 months out from then. But by the time I get there, there's going to be additional information from the people in the clinical trial. Yeah.
Would it be logical to conclude that one of the reasons the Johnson & Johnson vaccine is a lower percentage compared to the Moderna and Pfizer is that the tests that they did were later than Pfizer and Moderna, and so they may have had more people with the variants included when they did their tests?
Probably not, because it doesn't reach like 90-95% for people with the wild type or the most common variant. Yeah. Okay.
What about swimming in indoor swimming pools?
Wow, this is complicated. This is fancy. Indoor swimming pools even. That's a group setting. I would be against it. Yeah, because at this point in time, we're not for like large congregations for people from multiple households.
But they make you swim in a separate lane, and there's chlorine all around.
Yeah, so that's the other thing is that at this point in time, it seems like we probably early on overemphasized the transmission from fomites, which is like the fancy way of saying getting it from like an inanimate object and then like rubbing your eyes or rubbing your nose, where it's so just like I was saying, it's very difficult to study the spreader events outside. It's also very difficult to study spreader events from fomites, and so it's essentially just being in that indoor environment's the issue. The chlorine probably doesn't help you. So like the issue isn't the pool itself. It's just being under a roof with a bunch of people.
Oh, wow. Other questions, people?
Oh, well, yeah. I guess we're never going to be really rid of this.
I think we will. I know you may be surprised by that, but I actually think we will. It just takes time.
Okay, wait.
Pedersen, I don't know if this was already discussed or not, and I missed it, but I'm wondering, with this LabCorp test, do you have to have a prescription from your doctor? And how much does it cost? And is it covered by insurance?
Gotcha. I do not know how much it costs. It is usually covered by insurance. I don't think my few patients to date haven't had it not be covered.
Yeah, I know how much it cost. Oh, can you hear me?
Yeah, please share.
Yeah, my husband paid for his. It was under $50.
Oh.
That LabCorp test. I gave her my insurance card. I don't know if it'll go through or they'll charge me for it.
It may depend a little bit based on the diagnosis code that the doctor uses. I know that's sounds like a silly technical thing, but for what it's worth, I usually I check like immunocompromised due to medication, because it makes it very difficult for someone to argue against me, or just immunocompromised, which also makes it difficult for someone to argue against me.
And so does this require a prescription?
It would require an order from a doctor, as far as I know.
Okay. Thank you.
Okay, do you want to unmute, Norma? You have a question.
Does that do it?
Yep, you're unmuted.
So my question is, how soon do we consider having this testing done for that we're discussing? Like, do we do it right away after our vaccine, or do we wait a month? How soon do we get it done?
Yeah, I've been telling people to wait a month.
A month.
Okay.
Month, yeah. So there's kind of a key thing in that when you're exposed to anything to which you make antibodies, you initially make a certain type of antibody, that level spikes, goes down, and then you get like a different type of antibody that still sticks to the same stuff. And it's that different type that provides the long-term immunity. And that's what you really want to be testing for with the blood test. It's if you have, that's why it's that IgG. IgM are like the first wave of antibodies that you make. You then make IgG, and then people want to know if they can spread it themselves. And it sounds weird, but we make antibodies that end up in our mucosal surfaces. And what's not known is if we have a lot of the IgA antibodies against the virus in our mucosal surfaces after a vaccine. And that it's without that kind of information, you can't, it makes it difficult for people to predict your ability to spread it to others after being vaccinated.
I have a question. So I've been vaccinated, my husband's been vaccinated, and I'm taking CellCept. I haven't taken an antibody test yet, but next week I have my vaccinated parents flying from New Jersey coming here. And now, like, here I am thinking I've been vaccinated, they've been vaccinated, my husband's vaccinated. I just have a small daughter who's not, but nothing I can do there. So now I'm wondering if I should be panicking. I haven't taken this antibody test and I'm not a month out. I'm about 2.5 weeks out from my second dose. So should I go for this antibody test now, even though it's a little early?
I would wait, because that's when you're going to get reliable information. But it also seems like the grandparent role from the CDC applies to this situation, to where you should feel comfortable because of the status of your parents.
Yeah, the only problem is they're flying to get here, but yeah.
Yeah. the caveat, yeah.
Mm-hmm.
But then once again, we know that they're less, their viral load, should they have been exposed, would be less.
I have another question if you're done. About church attendance and singing in church.
Yeah. Yeah, that's a tough one, because most people have kind of figured out that the loud, powerful voices in a church, from a church choir, can really spread the respiratory particles. And so churches are another good example, to where I can see there being like one service at a certain time of day for people who've been vaccinated, another service for people who haven't been vaccinated.
Mm.
But until then,
out a lot of places are doing outdoor services. Choose that.
Susan, if we don't pass our antibody test, then we're back to square zero.
No, you have Johnson & Johnson that most of us would probably advocate for you to get.
That's after you've had Moderna twice.
I would say after you, so the Pfizer and the Moderna are essentially the same technology. So my guess is how you responded to one, you'd probably respond to the other one. And so if you tried Moderna and it didn't work, I would say it's probably not worth trying the Pfizer. But if that was available, so it's a thought. But I think, yeah, I would say, consider the Johnson & Johnson, and Novavax will looks like it's going to be approved at some point in time later this year.
And how does that differ from the J&J?
The Novavax is kind of so the J&J is a virus that codes for that has DNA in it that codes for that spike protein. And the Novavax is actually put the spike protein in you. They just inject the spike protein.
Are either one of those two worse for those of us who are immune compromised?
I don't know enough about the Novavax. The Johnson & Johnson I would feel safe about.
Okay, thank you.
Need a prescription for the, do we need a prescription since I've already had my full dosage, would I need a prescription? Is Medicare going to pay for it? I mean, I can pay privately, but I don't even know how I'd get it without a prescription.
I think that all these vaccines are going to be free for the foreseeable future. What I'm not sure how it's working is that when most of us have gone for our shots, they've taken information from you, including your social security number, and it goes into like a national database. I'm just not sure something like flags if you've already had a vaccine. I think it's more like an input thing rather than the input and get some information back at this point in time.
So I could maybe get another one and.
That's what I would do. Is I'd probably talk to your primary care doctor or your rheumatologist and see what they think.
Okay.
Dr. Pedersen,
Okay, there's some interference. I'm going to mute people. Okay.
you discussed
Sorry, I had to mute everyone for a second, but Carl, can you unmute yourself so you can ask the question?
Yes, you talked about waiting a month between tetanus shot and the vaccine. What about the shingle shot? When I got my vaccination, they did, during the screening, they asked about the shingles, or at least I asked them, and they said to wait 2 weeks. Is it 2 weeks or is it a month? Can't hear.
Brian, Dr. Pedersen, you have to unmute too. Sorry.
I can manage that there. 2 weeks should suffice.
Okay.
Okay, so Mary, you can unmute and ask your question.
Hi, Dr. Pedersen. Do you recommend stopping any of your medicines or holding off a medicine before you get the vaccine, like my Actemra or prednisone or any of those other medications?
Well, that's a deep question. I like that question. So I'll start. So the biologics, most people, if they're on a biologic, know what that is. So Actemra is a good example of a biologic. The biologics, surprise, surprise, do not affect efficacy of other vaccines. So because of that, we haven't been telling people to hold any of the biologics, or by and large, we haven't been telling people to hold the biologics unless there's some sort of special circumstance. Prednisone, that's a good example of a medicine that absolutely will affect the efficacy of a vaccine. Usually it's when you're at a dose of 20 milligrams or more a day. Most people in this group have hopefully never been on that kind of dosing, because usually we're scared to give people with scleroderma high dosing for a prolonged period of time. So prednisone can affect the efficacy, but at least for people with scleroderma, they're not typically on that kind of high, heavy dose. So I wouldn't alter the prednisone dosing as long as you're on less than 20. And if someone is on more than 20, I say wait until you get on a lower dose before you get the vaccine.
What about Plaquenil?
Plaquenil should be okay. Plaquenil will be okay. Methotrexate does lower the efficacy of vaccines. This is a good example of where if people are stable, a lot of us are saying hold it around the time of the vaccine. If you're not stable, you just keep taking it, and we'll check for antibodies after you've had your shots.
Okay.
Yeah.
Is that also true for CellCept?
There's not a lot of good data with the CellCept. There's the issue. Because you can imagine the number of people on CellCept isn't quite as high as some of the other medicines, so it becomes difficult to study.
What about
Arava? That's I like the Arava. That's the brand name for leflunomide. Medicine very similar to methotrexate. Arava's a little trickier because I was saying you would hold the methotrexate. It wouldn't be worth holding the Arava or leflunomide because of the very long half-life. It has a half-life of about 40 days. And so if you were to hold it around the time of vaccine, it wouldn't have significantly have washed out by the time you'd get the shot.
Okay, so I have okay, so if you think it lasts only 6 months, maybe hopefully longer, what is your opinion about having a big Scleroderma walkathon in August?
Great question. I would plan for it.
Yeah, okay.
I would plan for it. In August, yeah, that seems reasonable. The fallish, late summer, fall. I think I would plan for it. And if you got to pull the plug, you got to pull the plug.
Okay.
But at least you would know by then how long it usually provides an effect for most people. We just don't have information out after 6 months. That's the only issue. Yeah. Yeah, I this whole year I've been saying you can't really plan more than a month in advance, and I like the fact that people are trying to think 5-6 months out at this point in time.
Other questions?
Yeah, one last question. For in-person visits at UCSD, are you still requiring a test before the visit?
No. So it may depend a little bit on if you're going for a procedure or not.
No, just a routine visit.
So like a regular clinic visit,
Yeah.
no tests are required. Yeah. I don't know what things so like a good example maybe in this group is with pulmonary function tests, because you're creating a lot of particles doing that. I think for that kind of thing, they're still requiring testing in, a couple days before or so before pulmonary function tests.
Even if we're immunized?
Yeah, I would guess for the foreseeable future. Yeah. A good example is that starting back in December, we were having to get at UCSD, we were having to get tested on a weekly basis. The in-house positivity rate was somewhere between 3 to 4% on a weekly basis back in December. Everyone started getting vaccinated, and then it dropped to like less than 0.5% per week, to the point where they got rid of it because the only people who were testing positive were the people who said no thank you to the vaccine. So you could pretty easily predict who was going to get it at that point in time or who was at risk.
I just last week made an appointment with UCSD for a PFT for next week, and they didn't say anything about getting tested.
Fair.
So, of course, I'm very concerned.
Do yourself a favor and just call beforehand just to ask if it's their protocol or not.
I will, thank you.
Yeah, that way it saves you a trip maybe. Yeah.
I actually had a PFT and a mammogram and labs in late December, and I didn't have to get tested.
Interesting. Okay. Yeah, I know that. Yeah, so I'm certain that at the VA system in town, those people still have to get tested prior to that, to pulmonary function tests. For like nerve conduction studies, you sit next to somebody while they put needles in you for a little while. People are still getting tested for that prior to showing up. But for just normal clinic visits, no.
I've had a lot of infusion and shots in the Moore's infusion lab, one lasting 4 hours, and I didn't have to get tested. Maybe I should have.
Yes, that's a good point. At the Moors, people just assume that you have cancer, in which case, for better or for worse, they assume you're there because of cancer, and they don't want you to not get treatment for that. So the doors just really stay open, and just try to be careful. Yeah.
This is funny. As I walked in one time, I said, you know, I'm immune compromised, so could I kind of be off by myself somewhere? And she just smiled and said, so is everybody else.
Yeah. Yeah.
What did I know?
Yeah.
I had a COVID test for my PFT last week.
Is that UCSD?
No, at Kaiser. I got my COVID test on a Wednesday, and then I had my PFT on a Friday.
That makes sense. Yeah.
Mhm.
Yeah.
And also, doctor, my DLCO results was 3.39, but before they used to grade it like 69 or 66. So I don't know how to read a 3.39 for my DLCO other than the other system. So how does that translate to a different measure?
Yeah, good question. So those numbers are based on your age, your gender, and your height. And so you should be able to, even if you were to Google it, you should be able to convert that to a percentage predicted.
Yeah, so you Google that to figure out the percentage. That's what they used to read on my reports, but now I don't know what a 3.39 is versus last time it was 69 on my DLCO.
Gotcha. It really depends a lot. Even like the pulmonologists who look at those things all day long are always going through the chart to figure out what the actual number corresponds with.
Mm.
Yeah.
Okay.
Yeah, those charts are not like a secret. They should be they're pretty standardized. So it should be easy to convert.
Okay.
Yeah.
Do we have any other questions? I guess not. This has been amazing. And I would love to have your final comments, Dr. Pedersen. Of course, encouraging. No.
Yeah.
Yeah.
So I'm actually quite hopeful. I know maybe I've given a lot of negative information or like told people to kind of like hit the brakes on things today. But even before, like, you know, the president made some comments about, you know, maybe the 4th of July is going to be a little different. I was telling people, oh, you know, a few more months, we're all going to be there. That's essentially midsummer or so. And the reason I'm very hopeful is because, you know, there obviously have been hiccups with the vaccine rollout, if you will. We've been very lucky in San Diego, I feel. You know, it's everyone's probably had to struggle and push and pull a little bit to get their shots, but it sounds like everyone here today that's wanted a shot who's eligible has been able to get one, more or less. And that's kind of been the experience of most people. You know, if you are able to get it done yourself, or you have some kids that can help you get the shots, you've gotten your shot, and the shots work really well. And that's where we got really lucky in all this, is that all the shots work really well against the things that matter, meaning getting really sick and dying. And so I kind of think as more and more people get vaccinated, we're going to get out of this, get out of the quagmire a lot sooner than we would have guessed, back in December or so. Yeah. So I think a lot of people ask very specific questions at this point in time, and I think it's going to get to the point where the social situations are just going to happen, regardless of whether or not we know if they should or not, and they're gonna prove to be safe. So going back to the movie theater, going back to church, swimming at an indoor pool, those things are just gonna probably happen before we fully have all the information, because things are gonna open up faster than we're gonna have information, and nothing's gonna come of it. It's gonna happen safely. We're just at least I feel like I'm a little conservative at this point in time because we don't know enough, but I think what's happening already is very promising.
Great. Thank you so much. I mean, I can't thank you enough for entertaining all our questions. It's been fantastic. Everyone really appreciates you, your candidness, your honesty, and trying to keep all of us safe. I really thank you.
Very kind. Yeah, no, it's a fun group, right? It's a very fun group.
we are a really fun group, a great group, and everyone says thank you. And if anyone wants to stay on after we let Dr. Pedersen log off, you're welcome to do that. But thank you so much. We'll all be getting our antibody tests and and walking carefully through the next few months. So that's wonderful. Thank you so much.
No, hopefully we're walking together in August. That's the gist,
Yes.
right?
Yes.
Yeah. Fingers crossed. Yeah. Have a good Saturday.
Okay, thank you.
I wanted to say one last thing to Dr. Pedersen, pertaining to your closing comment about being hopeful. First of all, like Susan said, and I speak for everybody else, how grateful we are for you coming and answering all these questions for us. I know all of us had these same questions, so thank you for that. But as far as your hopefulness thing, what I come out of this, the top thing that I come out of this with in terms of being hopeful is your answer regarding the fact that even if we do screw up and we do something and end up getting COVID, it's almost 100% chance it's not going to be severe and die from it. So that is extremely encouraging. And so that's one of the biggest things I got out of your seminar today, basically.
Thank you.
So
Spread
thank you
that that to other people. It's not folklore. It's what you see in the medical journals and what's really happening. So please spread that to others, because that's what people need to know, so that they're not so choosy or afraid to get a particular vaccine.
Mm-hmm.
Yeah.
Mm-hmm.
Yeah.
Okay. Thank you again, Dr. Pedersen.
No worries. See you soon. Bye.
Okay, everyone,